The complaint came from a postal worker who'd noticed something unusual on his route. A medical clinic operating from a converted warehouse had been receiving an extraordinary volume of packages marked with biohazard symbols and medical supply labels. The clinic wasn't listed in any medical directories, had no signage beyond a small plaque by the door, and seemed to operate at odd hours. The postal worker thought it was worth mentioning to someone. Deputy Foster took the information and ran a basic check on the address. The property was registered to a company called Advanced Wellness Solutions, licensed as an outpatient surgical center. Nothing about the licensing raised immediate red flags. Outpatient surgical centers were legitimate businesses. But the postal worker's observation about unusual hours and the lack of public presence suggested it might be worth a routine inspection. County health inspectors had jurisdiction over medical facilities, but Deputy Foster decided to do a preliminary welfare check first. Sometimes facilities operating at the margins of legality were doing legitimate work for underserved populations. Sometimes they were doing something else entirely. A simple visit could clarify which category this clinic fell into. The address was in a light industrial area surrounded by auto repair shops, small warehouses, and fabrication businesses. The clinic building was nondescript, a single-story structure with no windows visible from the street. A small parking area held 3 vehicles. The entrance was secured with a keycard access system, unusual for a medical facility that should be welcoming walk-in patients. Deputy Foster pressed the intercom button and identified himself. After a long pause, a voice asked about the nature of his visit. He explained he was conducting a routine check following up on questions about the facility's operations. Another pause, then the door buzzed open. The interior was clinical but minimal. A small waiting area with a few chairs, a reception desk behind glass, and a locked door leading to what presumably were treatment areas. A woman in scrubs appeared at the reception desk, introducing herself as a medical assistant. Deputy Foster asked about the facility's services and hours of operation. The assistant explained that they provided minor surgical procedures for patients who didn't have insurance or couldn't afford traditional medical care. They kept a low profile to minimize overhead costs and pass savings to patients. The odd hours accommodated people who worked during the day and needed evening appointments. Everything sounded plausible, almost commendable. Deputy Foster asked if he could see the surgical areas to verify they met basic safety standards. The assistant hesitated, then said she needed to check with the doctor. She disappeared through the locked door. Several minutes passed. When she returned, she said the doctor was in the middle of a procedure and couldn't be disturbed. Perhaps the deputy could come back another time. That hesitation triggered Deputy Foster's instincts. Legitimate facilities had nothing to hide and welcomed inspections as opportunities to demonstrate proper practices. Evasiveness suggested something worth concealing. He informed the assistant he would wait until the procedure was complete and speak with the doctor then. The assistant looked uncomfortable, but agreed. Deputy Foster sat in the waiting area and observed. The facility was too quiet for a legitimate surgical center. No sounds of medical equipment, no overhead announcements, no staff moving through public areas. For a place claiming to serve patients who couldn't afford traditional care, there were no patients visible or audible. After 20 minutes, Deputy Foster stood and approached the locked door. He could hear voices beyond it, low and urgent. The assistant immediately moved to intercept him, insisting he couldn't go back there without authorization. Deputy Foster explained calmly that, as a law enforcement officer responding to concerns about facility operations, he had the authority to conduct a safety inspection. If the facility had proper licensing and was operating legitimately, this would be resolved quickly. The assistant made a critical error. She attempted to physically block the door while reaching for her phone. That action suggested she was concealing something immediately dangerous or illegal. Deputy Foster radioed for backup and informed the assistant he was entering the treatment area based on reasonable suspicion of illegal activity. He pushed through the door into a hallway lined with rooms. The first room he checked appeared to be a recovery area with 3 beds, all occupied by people who were clearly sedated or unconscious. They had fresh surgical bandages and IV lines running. None of them looked like they were in a normal post-operative state. They looked drugged heavily, beyond what would be appropriate for minor outpatient procedures. The second room contained medical equipment that seemed excessive for minor surgeries. Advanced monitoring systems, surgical tools more appropriate for major operations, and preservation equipment designed for organ transport. Deputy Foster's concern escalated to alarm. The third room was occupied. Through a window in the door, he could see what appeared to be an active surgical procedure. A person was on a table, surrounded by individuals in surgical gear. But something was profoundly wrong with the scene. The level of equipment, the intensity of the procedure visible even from outside, this wasn't minor outpatient surgery. Deputy Foster forced the door open, weapon drawn, announcing his presence loudly. The surgical team froze. What he saw on the table confirmed his worst fears. This wasn't a legitimate medical procedure. The patient had massive incisions, organs partially exposed, and the team had clearly been in the process of harvesting tissue when he'd interrupted them. The man who appeared to be the lead surgeon started to speak, claiming this was a legitimate procedure, that they had consent, that this was all legal. Deputy Foster ordered everyone to step away from the table and keep their hands visible. Backup units were arriving. This was now a crime scene. Additional deputies secured the facility and called for emergency medical personnel. The patient on the table was in critical condition, the surgical procedure having been interrupted mid-process. Paramedics worked frantically to stabilize them, while investigators processed the scene. The three sedated individuals in the recovery room were also evaluated by medical personnel. They had all undergone recent surgical procedures, all had organs removed, and none of them were in any condition to have provided informed consent. They had been heavily sedated and operated on without proper medical protocols or safety measures. As investigators searched the facility, the full scope of the operation became horrifyingly clear. This wasn't a medical clinic serving underserved populations. This was an organ trafficking operation that lured vulnerable people with promises of money or medical care, then harvested their organs for sale on the black market. The facility maintained detailed records, perhaps because the operators believed they were sufficiently hidden to avoid detection. Files showed 23 people had undergone procedures at this location over the past 14 months. Most had sold a kidney, believing they were participating in legal compensation for organ donation. Others had been deceived more completely, thinking they were receiving treatment for medical conditions when they were actually having organs removed. The operation worked through multiple deception vectors. Some victims were recruited through online advertisements offering significant money for kidney donation. The ads presented it as legal and safe, a way for healthy people to help those in need while earning $10,000 to $30,000. When people responded, they were brought to the clinic, told everything was legitimate, and had organs removed in procedures that carried enormous medical risks due to inadequate facilities and improper follow-up care. Other victims were immigrants who'd been promised free medical care for conditions they couldn't afford to treat through legitimate channels. They'd come seeking help for diabetes, heart problems, or other serious conditions. Instead, they'd been sedated and had organs removed without their knowledge. They'd been told afterward that their medical issues had required surgery, not informed that healthy organs had been harvested and sold. The financial records revealed the operation had generated over $1 million in the past year alone. Organs were being sold to intermediaries who connected them with recipients willing to pay black market prices. A kidney brought $40,000 to $60,000. Other organs commanded even higher prices. The victims received a fraction of what their organs were sold for, if they received anything at all. The medical personnel involved were not all licensed doctors. The lead surgeon had been a physician once, but had lost his license in another state for ethical violations. He'd moved to this jurisdiction and established the illegal clinic, recruiting medical assistants and technicians willing to participate in exchange for money. None of them were concerned about the health or well-being of the victims. They were focused on extracting organs as efficiently as possible to maximize profit. The facility's location had been chosen specifically for its isolation and low visibility. The industrial area meant irregular hours and unusual activities wouldn't draw attention. The lack of windows and secure entrance prevented casual observation. The operators had believed they could continue indefinitely without detection. Federal authorities arrived within hours. Organ trafficking triggered multiple federal statutes, and the interstate nature of the operation brought FBI and Department of Health and Human Services resources. Investigators began tracing the network: who supplied the equipment, who purchased the organs, how victims were recruited, and whether other locations were operating similar schemes. The 4 people found at the clinic during the raid were transported to legitimate hospitals for proper medical care. The patient who'd been on the table during the interrupted procedure survived, though the emergency nature of the situation and the damage already done resulted in permanent health complications. The 3 in recovery rooms were stabilized, though they all faced long-term health issues from having organs removed in unsafe conditions. As victims were identified from the clinic's records, investigators began the difficult process of contacting them. Many didn't know they'd been victims. They thought they'd participated in legal organ donation or had received legitimate medical treatment. Learning the truth was traumatic. They'd been violated in one of the most fundamental ways possible, had parts of their bodies removed. Medical evaluations of identified victims revealed widespread problems. Several had developed serious complications from the procedures: infections, organ damage, chronic pain. One man had nearly died from internal bleeding weeks after his procedure, saved only by emergency intervention at a hospital where doctors had been confused about why someone with no documented medical history. The psychological impact was profound. Victims struggled with violation of bodily autonomy, betrayal of trust in medical professionals, and anger at having been exploited when they were most vulnerable. Many had agreed to donate organs because they were desperate for money to support families or pay debts. Others had trusted that they were receiving legitimate medical care. All had been deceived and harmed. The lead surgeon and his 4 associates were arrested on charges including organ trafficking, aggravated assault, conspiracy, and practicing medicine without proper licensing. Additional charges were added as investigators documented each victim and each illegal procedure. The evidence was overwhelming and deeply disturbing. The investigation expanded as federal agents traced the organ recipients. Wealthy individuals in multiple states had purchased organs through intermediaries who advertised discreetly in circles where people knew illegal services could be obtained. Some recipients claimed they believed the organs were from legitimate deceased donors. Others had known or suspected the organs were obtained illegally, but had prioritized their own survival over ethical concerns. Prosecutors struggled with how to charge recipients. Using a trafficked organ wasn't specifically criminal in all jurisdictions, though it could constitute conspiracy if recipients knowingly participated in the illegal procurement. The focus remained primarily on the traffickers themselves, who had created the supply through exploitation and medical abuse. The facility was seized as proceeds of criminal activity and evidence in ongoing prosecutions. The medical equipment found inside was cataloged and analyzed. Some of it had been purchased legitimately but diverted to illegal use. Other equipment appeared to have been stolen from hospitals or medical supply companies. The combination of legitimate and black market supplies had allowed the operation to function without drawing attention from medical equipment suppliers who might have questioned why an outpatient clinic needed advanced organ preservation systems. Civil litigation followed as victims sought compensation for medical expenses, lost wages, pain and suffering, and the lifetime health complications they now faced. The clinic's operators had assets, but nowhere near enough to adequately compensate all victims. Settlements would be insufficient, leaving victims to manage health problems and financial losses with minimal support. The postal worker who'd filed the initial complaint was quietly commended for his observation and willingness to report something that seemed unusual. His attention to patterns on his route had led to the exposure of an operation that was actively harming people. Without his report, the clinic might have continued operating until a victim died or someone else accidentally discovered the truth. The case prompted examination of regulatory oversight for outpatient surgical facilities. The clinic had obtained legitimate licensing by misrepresenting its intended services and had never been inspected after initial licensing approval. New protocols were developed, requiring regular unannounced inspections of all facilities performing surgical procedures, with specific attention to those operating in unusual locations or with minimal public presence. Medical boards in multiple states reviewed their procedures for tracking physicians who'd lost licenses. The lead surgeon had been able to operate illegally, in part because there was no comprehensive national database alerting authorities when someone with a revoked medical license attempted to practice in another jurisdiction. Interstate cooperation was strengthened to prevent similar situations. The trial began 18 months after the raid. Prosecutors presented devastating evidence, testimony from 4 victims found during the raid, and additional victims identified through records, medical experts explaining the improper procedures and dangerous conditions, financial records showing the systematic profit from human exploitation, and communications between the operators discussing how to maximize organ extraction while minimizing detection risks. The defense attempted to argue that victims had consented to organ donation and understood the arrangements. This argument crumbled under examination. Consent required full information about risks, alternatives, and the legitimacy of the procedure. None of that had been provided. Victims had been lied to about the legality of the operations, the safety of the facility, and the true nature of what was being done to them. The lead surgeon showed no remorse during proceedings. He argued that he'd been providing a service, connecting people who needed money with people who needed organs. He claimed to be a pragmatist addressing dysfunction in the legitimate organ donation system. The jury and judge found this argument morally repugnant and legally irrelevant. He'd exploited vulnerable people for profit, caused serious harm, and violated fundamental medical ethics. The verdicts came quickly. The lead surgeon was convicted on all federal charges and received a sentence of 35 years in federal prison. His medical license was permanently revoked nationwide, though that was largely symbolic given his prison sentence. His 4 associates received sentences ranging from 12 to 23 years, based on their roles and level of participation. For the victims, the convictions provided some measure of justice but didn't address the ongoing health complications and psychological trauma. Several formed a support network, helping each other navigate medical care and processing the violation they'd experienced. Some became advocates for stronger regulation of organ donation and prosecution of trafficking operations. The facility building was eventually demolished. The property owner, who'd had no knowledge of the illegal activities, cooperated fully with investigators and supported the decision to destroy the building rather than allow it to be used again. The site remained vacant, a small lot in an industrial area where 23 people had been exploited for their organs. Deputy Foster's decision to follow up on the postal worker's observation and to insist on inspecting the facility, despite resistance, had saved lives. The patient on the table during the interrupted procedure would have died without immediate intervention. The 3 in recovery were at serious risk of complications that would have been fatal without proper medical monitoring. And the operation would have continued, victimizing more people who trusted that medical professionals would protect rather than exploit them. The case became a training reference for law enforcement nationwide. Organ trafficking existed not just in distant countries but in industrial parks in ordinary counties. It hid behind professional facades and legitimate-appearing licensing. The warning signs were often subtle: facilities operating at unusual hours, lack of normal patient activity, excessive security measures, and reluctance to allow inspection. What had started with a postal worker noticing unusual package volumes had exposed a 14-month operation that had trafficked organs from 23 victims and generated over $1 million through systematic exploitation. The numbers told part of the story: 4 people rescued during the raid, 23 total victims, $1 million in illegal revenue, 35 years in prison for the lead surgeon. But the real measure was in lives saved by interrupting active harm, in an operation shut down before more people could be victimized, and in a community's recognition that evil could wear medical scrubs and operate. The clinic was gone. The traffickers were imprisoned. The operation was dismantled. But the echoes remained in victims dealing with permanent health complications from illegal surgeries, in the psychological trauma of having bodily autonomy violated in such a fundamental way, and in the persistent reminder that vulnerability could be weaponized by those willing to treat human bodies as sources of profit rather than as people deserving dignity and protection.